If I deal with educators who have the one thing, it answers everything.
Sure.
I get very nervous very quickly. And what I found with my clients was I got very good at manual therapy. Oh, you're having pain? Where are you having pain? Asking them questions and applying a soft tissue technique that would help them fairly rapidly. That's my current highest skill set.
Sure.
Now I'm in a place where I have mashed everything in creation. And I'm looking for more, which is kind of how we fell into, talking and chatting, conversing. What I find most interesting about what you said about the pitcher will trust you. Then you said, oh, they got a high arch. Those little things are something I notice as an educator because you're using more specific language that would resonate with, say, a personal trainer or a physical therapist. But then the consumer goes, oh, they were just talking about some muscles and the arch of the foot. So it makes it easy for the bus driver to understand what's going on. My clients, I never lorded it over. It was always like, hey, Frank, what's going on? Oh, man, you're having problems that like there's pain running down the back of your leg? Oh, okay. And if, let's say he was having a case of piriformis syndrome and I applied a soft tissue technique, worked on his piriformis, and he's like, oh, man, that's amazing. How is that better? And I'd go, Frank, as best I can understand, and I'd go to the anatomy chart and just show him. As I worked with clients and they had increasingly challenging problems. So you talked about pitchers. It's got to be really challenging. When I hear pitchers, I go, oh, shoulder joint, massive rotator cuff, like, intense strain physically on this very specific area. My clients respected me more when I said, listen, this is what I think I understand, but there's this other component. My colleague who is an acupuncturist had worked on someone, they were having pain down their leg. He said, Robert, listen, I'd like you to contact this guy, see if he'll get a session so you can deal with your soft tissue component. I think something's going on. Based on what I was hearing, I went, I think he's got a bulging or herniated disc. This is just talking to the acupuncturist. I go in for the session, work with the guy. He's got a little referred pain from his QL or maybe his piriformis, but, I told him before I ever put hands on him, listen, based on the information you're giving me, this is not a, how do I put this? I'm not prescribing anything. I'm not diagnosing anything. I'm just saying, based on what I've seen in clinical practice, it sounds like you might have a herniated disc or a bulge.
Sure.
I don't want you to think that's the end of the world. People have herniated discs and bulges and have no pain at all. If that is in fact the case, you're probably going to get limited benefit from what I'm about to do. Then you're going to need to go and see the doctor for the scans. And sure enough, he felt better by about 2 points on a pain scale.
Sure.
He got a little relief. But went to the doctor 2 weeks later, messages me and says, hey, you were right. It was a herniated disc. I think his expectation of my professionalism and his opinion of me went up, not because I was trying to rebook him for another session, another session. It's that I knew enough about the soft tissue to know, hey, I think you're having a deeper issue. I can't manually, put back in place.
Dude, I think it's so important to understand, where your work is, the limitations of it.